Hi, and welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board-certified veterinary dentist, and we bring this show to you every Wednesday, the general practitioner and the technician, to help you and your dentistry team become even better at veterinary dentistry. And today we are so pleased and honored to have Trudy Bowden with us. She is a longtime friend and colleague and also a veterinary dental practitioner. Welcome, Trudy.
Thank you. Glad to be here.
Well, I'm going to just ask you to introduce yourself to our audience and just give a little backstory, if you will, where you are and a little bit about yourself.
Sure. So I graduated from NC State in 1999. I worked for a decade in Cary, North Carolina, and then my husband and I moved to Oxford, a little rural town about an hour north of that, where I took a year off and then joined the practice where I started my dental journey, and the rest is sort of history. So I took some notes just to keep me honest on my timeline. I took a seminar from you in 2014 in Raleigh. It was an all-day seminar. I think it was The Secrets of Dental Success or something like that. And that really re-sparked an interest in dentistry for me that I had in my early career. And then I joined the Veterinary Dental Elite group that you started in 2015. And that's when we began our journey expanding the dental service at my practice.
And tell me, and the audience, how many children did you have at the time and how many do you have now?
3. I had 3 then, have 3 now. At that time, I had a teenager, a toddler, and a newborn.
Despite all those odds against you, you've done very well.
Yes.
So dive into that a little bit. And because when you started off initially, you were just taking a course or probably not feeling super confident coming out of that course and then going into practice. And so tell us that progression, that story.
Sure. So I joined the Dental Elite, which was the group that you had that met monthly to discuss cases and just a foundational mentorship program. And I began just a concerted focus on dentistry in my practice where it's a marathon, not a sprint. We started looking at what our revenue was for dentistry and what we weren't doing, most importantly. I think I came away from that initial seminar with you with just a sense of once you're better, you want to do better. And we were not doing dental radiographs at that time. And I started to do more surgical extractions, and just that focus on doing better technique increased our revenue to the point I was able to get the ear of management and my practice owner to move forward getting dental x-rays in our practice in 2015. And that was just such an eye-opener. We knew we were missing pathology, we just didn't know how much we were missing. In fact, if I can share my screen, I wanted to show you a picture of our very first patient that we used our dental x-rays on. And this was a slam dunk that got everybody really excited about doing dentistry in this small rural practice.
For those of you who are not watching on YouTube, let me describe this lesion that Dr. Trudy is about to talk about. And we've got the left mandibular first molar that's got bone loss all the way from the furcation, mesial and distal on the mesial root, all the way around that root. So there's a big black hole around the whole root extending almost to the ventral cortex. And that's all from periodontal disease, although grossly, as she'll describe, she didn't see much from the standpoint of pathology. And then on the distal root, we have a much less involved lesion with the periapical lucency around the distal root.
So this was Cupcake. She was a 6-year-old toy poodle that the owner had just noticed a little bit of foul breath. And we told her we were very excited to have a new diagnostic tool in the hospital and asked her if she'd be willing to let us do full mouth x-rays on her dog in conjunction with a dental assessment. And she heartily agreed. And we were just dumbfounded at the pathology present in a relatively normal looking mouth. That is a dark photo, but she only had a little focal area of gingival recession. And everyone was literally an audible gasp. From the entire team was outside the room waiting for us to develop the x-rays. And this is why we do what we do. So that was a nice opportunity for us to get everyone excited about dentistry. And we instituted full mouth x-rays, non-optional, in 2016. And at the end of 2017, we had increased our revenue by 5-fold. And that's not the most important thing, but it just underscores how much pathology we're going to find if we're doing full mouth assessment with dental radiographs. We paid for our equipment in less than a year. And it's just been the most rewarding thing I've ever done in my career. The process between 2015 and 2018 involved taking all of your courses, the canine weekend, the feline weekend, and the advanced surgery weekend. And it has just been a continued process of learning.
You are definitely to be commended for everything that you've done, especially with 3 children and all the professional obligations that you had. And obviously, that journey was not always without some type of challenges.
Oh, no doubt.
I don't know if you have any specifically that come to mind that you would want to share that might be able to help the audience.
There were probably 2 different categories of challenges. One you mentioned was just life balance, trying to maintain a home and parent children and have a full-time job, and also trying to grow professionally into a new area. With me being the primary person in my practice, I didn't have a mentor to train me on site. So the mastermind group was an essential foundation for go-to help. So lifestyle balances were certainly a challenge. And then just running into tough cases, not knowing how to handle a particular complication, how to recover a root that has been broken off in the process. And those days were sometimes fraught with frustration and am I cut out for this? Should I really be doing this? Am I good enough to do this? And thankfully, with good support in my family and good support from my employer and from your team, as soldier on, get her done, so to speak. The biggest challenge I think I ran into was in 2020. COVID was around the corner. Or no, that was COVID. I had a health scare in the fall of 2020 and just really restructured and reprioritized my whole life and fell back on an episode that we've talked about before, the morning routine, how important that is to be a foundation for success. And I charted a course to finish the program in 6 months and was grateful to meet that goal in May of 2021.
Well, that was an amazing story and progression of overcoming challenges. And there are numerous people that are listening that have taken that same path, and you have taken the steps to take action to make sure that you were successful. And I encourage everyone listening that's going through those same challenges to look at Trudy as an example of someone who doesn't quit despite any odds and will power through, find answers to the challenges, and meet those challenges no matter what it takes. And in order to be successful in dentistry or be successful in anything in life, that's the way that the people that are successful, that are like Trudy, that's the path that they take. And let that be encouragement to everyone and allow you to draw on that, draw on stories like Trudy's and think, hey, we're not alone. Trudy went through that. I personally went through a lot of personal challenges in my life. I won't bore you with the details. We'll save that maybe for another podcast. but the embracing of routines and applying things that you learn that help you invest in your learning, invest in your personal development, aside from dentistry, aside from anything you're doing in your practice, is super invaluable. So we really appreciate you being a role model for that.
Oh, thank you. It feels like a very basic, non-exciting story from my perspective, but there have been many mentors along the way, that you included, Dr. Reed, that have made this journey possible. I don't know where I read it or saw it, but a question that really resonated with me when I started a laser focus on this dream was, what would you do if you weren't afraid? And I had an immediate answer. I want to do dentistry full time. And I wasn't even sure that road even existed. So it's there.
There's so many good things that we can draw out of that. And if I look at that and I look at your progression, the thing that jumps out at me is that you have you had and have a passion for dentistry and a passion to help your patients using dentistry as that medium. And it possibly has become, and I'd like you to answer this, your purpose.
Oh, absolutely. Yes. I love client education. In fact, I still have to get pulled out of the room during consults because it's just something I could talk about for hours and hours. The return on that investment, professionally, personally, is just without compare. And I feel truly blessed.
I'm probably going to botch this quote up a bit, but it's so helpful. Mark Twain said that there are 2 days that are the most important in your life. The first is when you were born, and the second is when you find out why. You took that passion for dentistry and then you gave it legs. You took action and you made it a purpose. And consequently, that's part of the reason why you're so successful today, and part of the reason why you're making such a huge impact on your patients and the clients, and certainly your practice. And remind me, you're in charge of the dentistry service at the practice now. You guys just got into a new facility. Tell me what the practice dynamics are like right now from a dentistry standpoint where you're at.
Oh, so probably a point for clarification. So in my former practice, I was the lead on our dental team. It was myself, a technician that I took under my wing, and we were the go-to people for consultations with clients, talking about the need for dentistry, the need for x-rays. And that was where I was when I completed the VDP program. And I sent a thank you letter to another one of my mentors for helping me achieve that goal. And it turns out that he was building an expansion of his dentistry practice. So I'm actually in a different hospital now. So I'm not the lead. I've gone from being the top guy at a small hospital to a small guy in a big hospital, with Dr. Dawn Hoover is my senior clinician. I'm back in a role as a student. Incredibly honored to be here. I'm still learning every single day. We teach. We have 11 veterinarians every other month that come in for an all-day surgical extractions lab that we teach. And that is humbling, but also nice to see how far you've come. Wow, I remember when I was in that seat and when I was struggling, making that flap or pulling that tooth. And so it has come full circle, which I didn't think I would enjoy teaching, but I have really enjoyed that aspect of it. And I continue to learn even in that role.
Amazing journey. And I want to back up a little bit because this becomes important to the structure of practices that are not quite where you are yet, but are getting there. And one of the things that I remember that I pulled out several years ago with your progression was the fact that with any dentistry consultation within the practice, they would call you in as the
Correct.
person that did dentistry. And that, I think that is a huge thing for practices in general, especially multi-doctor practices, to have one person, the person who's most talented, the person that's got the most passion, to be that go-to person that literally comes in as the local, not taking specialists out of context, obviously,
Right.
but you're the in-house person, you're the go-to person for dentistry who has the most knowledge. I would rather you talk to Dr. Bowden about this because she can put a different twist on it and give you more information
Sure.
than I can. And that's something that I would strongly suggest that our listeners take to heart. And certainly not all of our listeners are the decision maker in the practice, but if you're that person, if you're the most talented in dentistry and have the most passion for dentistry in your practice, you probably should be the only one doing dentistry in that practice.
Absolutely.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.